Hi, my name is Rick McDermott with Senior Solutions Group, and we help people understand Medicare and get the most benefits that you are entitled to for Medicare. One of the things that we come across a lot is people paying a lot of money for prescription drugs. Often, if you're on Medicare, you might get a surprise in the middle of the year where your prescription price doubles or triples in the middle of the year. So I'm going to introduce Ryan Vlasin with Senior Market Sales. He is a licensed pharmacist and an expert in prescription drug plan options and get his perspective and his take. You know, we're always looking around the corner to help people understand how Medicare works, and why not talk to an expert? So stay tuned for Ryan. Ryan, why don't you give a quick bio of yourself and we'll go from there. And tell us what you do as well, what your role is.
Absolutely. Thanks, Rick. Yeah, so I kind of started in the pharmacy industry. I was actually working as an analytical chemist at Pfizer, the drug manufacturer, while I went to pharmacy school. So I was kind of doing both. When I graduated from pharmacy school, I did retail pharmacy for about 10 years with companies like Walgreens, CVS, and independent pharmacy as well. And after that 10 years, I wanted to transition. So I found a job here at Senior Market Sales, and I'm their pharmacy director, and that I really am kind of a subject matter expert for all things pharmacy, a lot of quoting and coverage scenarios. So when you're a consumer transitioning to Medicare, there's a lot of questions usually and a lot of gray areas, and you just need help. And we have great agents like Rick that are, going to help answer a lot of those questions because it can be very confusing. And that's my primary role here. I work with some of the quoting technology to make sure that we can get it as clear as possible for agents and consumers who are transitioning to Medicare.
That's great. So, one of the things that we often find with our clients is a lot of confusion for people that are on expensive drugs, sorting through all the clutter that they hear in the news, on TV, with commercials, mailers, and trying to sort through which drug plans are the best option. Typically, a state might have two dozen drug plans for standalone Part D on top of all the Medicare Advantage drug plans. So what are some of the maybe the top three or so issues that you see consumers face with, or maybe three of the biggest challenges that we as agents can help them address?
Sure. So there are a lot of consumers that are going to have a decent sea change when they move from their employer coverage or their group coverage to something like Medicare. And so historically, they might be used to paying a set copay for their medications, and that never changes on their employer insurance or their group insurance. But when they go to Medicare, there could be 4 different copays during the year, depending on what phase of coverage they're in. So most of these Part D plans, and a lot of consumers will go with a Med Sup and then a Part D to accompany that, or they'll not do the Med Sup route and they'll go the Medicare Advantage route, and that has the same type of a Part D drug component. And when they make that transition from commercial insurance to Medicare, regardless of what plan they really pick to cover their medications, there's going to be different phases of coverage. And that can be tricky because they might start off at the beginning of the year paying the full out-of-pocket cost for medication until they meet their deductible. And then they're going to transition to a low copay potentially, but then that might change if they go in the coverage gap, and it might change again when they go into catastrophic. So it can really be a challenge for consumers to understand why a complicated product would have 4 different copays for the same medication.
Absolutely. And that's one of the biggest issues. It might be January, a customer might have at a pharmacy maybe a 25 or a $40 copay for Trulicity or some of these expensive inhalers. And then in maybe June or July or August, they might call us and say, oh my gosh, I went to the pharmacy and I was thrown for a big curveball. It was $140.
Yep, exactly. And a good medication where we see that a lot is something like Eliquis, which is a kind of a new generation blood thinner.
Or
Runs around
Xarelto.
500. Yeah, exactly. They run around $500 a month. And so someone starts off at the beginning of the year and they're paying that $40 copay and they're happy with that. They think that's reasonable. And then you're right. When they go into the coverage gap, they're now paying 25%, and that $500 medication has a $125 copay. And they might not remember that that was going to be the case, because again, we're talking about these plans in October usually, or November, and then by the time they hit the coverage gap, it might be the middle of the next year. So it's hard for them to remember that, and it's just can be a confusing product. So that definitely trips consumers up sometimes.
What are one or two tricks of the trade that you could recommend people in these types of situations?
Well, a lot of times with something like a blood thinner, you can't really mitigate that cost other than to know upfront that there's a potential that you're going to go into the coverage gap, and to try to budget, try to understand that and budget that. So when that change goes from $40 to now 125, you've kind of accounted for that and you're prepared for that. The last thing we want is for a consumer to, not be able to afford a medication. And so even if you have to reach out to your doctor's office for help during that period of time, they might have a sample or two to get you through while you're trying to figure out what you're going to do to afford a medication when you have a dollar change like that. Um, we know that the copay coupons that you may have used when you were on group insurance aren't going to work for Medicare.
That's right.
And that's difficult too, because a lot of consumers, when they transition, they say, well, I've got this copay card. This only cost me $5 or $10.
Right.
And unfortunately, Medicare recipients are excluded from that. And I'm not sure why, but they are. And that can be difficult when people transition. So I think the easiest thing to do is to, if you have an issue that's really causing you some stress and you're working with a good agent like Rick, he can get some of those questions to me, and we can certainly work to try to make that situation as good as possible. I think that's one of the biggest benefits you have in working with like an independent insurance agent is they're going to put you in the best plan across the whole landscape of plans. If you call a carrier directly, you're maybe not going to see all the plan options. So working with a good independent agent that gives you all the different plan options, gets you in the right plan, a good fit, and then has access to someone like me that can really help you if you need a coverage exception. Sometimes your medication is not going to be covered at all. It might be a new medication that you were put on during the year. You had no idea. You hadn't planned for this. What do I do? It's not covered. We can help you get some options for your doctor that's going to be covered. It's going to be the best solution for you. Sometimes we can transition that to a Part B covered medication, and that might save you a lot of out-of-pocket costs.
So Part
But
B
yeah, we have
medication
some
would be
options.
covered by Medicare itself, as opposed to a Part D as in drug, where you.
That's correct. So sometimes you'll see an option to change to a slightly different medication, but still covers the same affliction, but that's going to coordinate through Part B. And so that will lower someone's out-of-pocket costs significantly sometimes, if that's an option. Not always an option, but it's a good thing to explore among other things that we explore when we're trying to help someone.
So we often see people that are on drug plans that change their premium, and people don't realize it until January because they did not read their annual notice of change letter that the government requires the insurance companies to send out in September. So either they throw them away, think it's junk mail, more junk mail from my insurance company. They don't read them. And then the next thing you know, it's like the frog in the pot of water. Oh, it went up to boil all at once instead of gradually. So what's your comment on that?
Yeah, we definitely need to check those annual notice of changes. And a lot of plans do up the premium every year. And so it's a good thing to look at your plan options in October and November. You have until December 7th every year to make a decision, but it's in your best interest. You will save money almost every year exploring your options and making sure you're in the best fit plan, because aside from premium changes, they can drop one of your drugs off of their formulary, which could be catastrophic for someone on a very particular drug that only a few plans cover. If you lose that coverage, that can throw you a real curveball and even affect your health early in the year as you're scrambling to try to find coverage. You don't want to have to stop that medication. So definitely check your options every December. These plans can and will change. We expect some of those premiums to change every year. So if you do your due diligence, work with your agent, it's just a really good thing for peace of mind to know you're not paying any more than you need to pay for the best coverage.
Correct. And when Ryan says check with your agent, if you have an agent that has worked with you over the years, that's fantastic. Check with your agent. If you're more of a do-it-yourselfer, there are some technology tools that you can utilize that we have at our disposal that Senior Market Sales has as well. Also, Medicare.gov is a good resource to consider. But if you want to talk to an agent that is an expert, that's what we do at Senior Solutions Group. And doing it on your own, you may find some success, but it might be a good idea just to get a second opinion, even if you are more of a do-it-yourself type person.
Yeah, I think that's great. Great comment, because what a lot of consumers don't realize is we have seen the cost for both medications and medicine in general go way up, especially for people transitioning to retirement. So it's the one thing that you really want to get right, and a second set of eyes or someone that you trust who does this for a living is really helpful. It's one of the greatest things that you can do to make sure you're not overpaying for anything. And working with an agent that can really look at all the different carriers at one time quickly and efficiently and get you to that right plan is something you're probably not going to be able to do if you reach out directly to an insurance carrier. They're going to show you their plans. But if you work with an independent agent like Rick, he can look at all the plans and get you in that right fit plan efficiently.
Yep, we can do that side-by-side analysis independently, and it doesn't cost you any money to use an agent. It's the same price as if you were to do it on your own. So that's the beauty of using an agent that is professional, that we can do all the research. And if we don't know all the answers, we can reach out to Ryan, and we have a team to help you. And so thank you so much, Ryan, for taking the time during this busy season to help us understand Medicare Part D prescription drug insurance. We really appreciate it.
Yeah, happy to be here. I love it when agents are really trying to be a good advocate for their clients and make sure they're in the right coverage for them. So appreciate the time.
Thank you so much for checking out this video. Wasn't Ryan great? Had a lot of great information and insights. Not every day that we get to talk to a pharmacist. If you have any additional questions or comments, feel free to comment down below. And if you haven't done so already, please subscribe to our channel, and please share this with a friend and make it a great day.